COVID-19. This is not a new term. However, situations as well as regulations of Vietnamese government changing day by day. Therefore, we think that it would be very helpful to invite our expert in this area to be here today, sharing with us about the COVID situations in Vietnam. And I'm very pleased to introduce Dr. Lee from Dr. Elware. She's an expert in this area who can provide us most updated information about COVID situation in Vietnam. How should we prepare ourselves to cope with and step back to work in a new normal life? So thank you very much, Miss Dr. Lee and her college. Also some of the colleagues from Aeon. Yeah. So over to you.
Okay.
Please.
Yeah. Hello, everyone. Good afternoon, and I'm very happy to be here today for the health talk, and we can discussing some issue about COVID-19 that we are very familiar with during 2 years. Right, we are going to the next third years. And for start the discussion, I would like to introduce that about me. You can call me Dr. Lee, and today I'm going to present and want to discuss about three main sections here. The first is I would like to tell you some update COVID situation in Vietnam, and the second is set back to work in new normal life, and the third, very important, that when we come back to a new normal life, how to the best tip for COVID prevention and be healthier, and we will have well-being in new normal life. And as you know, that we have tons of information about the COVID situation. So first of all, I would like to ask you some question that you all know about the structure of virus SARS-CoV-2, and because of its very simple structure, so it's easy to spreading, and we should know that the virus primarily spread between people though close contact and via aerosol and respiratory droplets. And when we know about this structure and know how to transmission of this virus, we will know very well how to prevent it, to reduce and limit the chance to got the virus. And I would like to ask you that, what do you think about this prediction? The other side is that because the virus is still living and mutation, so it can be more dangerous, or it can be easier to infect between people. And we all listen and read many articles about the newest variants. It's called Omicron, and it is one of the variants of concern that WHO aware us to, because it may be very easy to transmit from people to from person to person. And the other side, that our expectation that in somewhere in this world the coronavirus it disappear, such as in Japan or in Africa. So what do you think? I think that most of us really want to see that they really want to hope that the end of this pandemic is coming soon, right? But for reality, that because the virus SARS-CoV-2 is very simple structure, so it's very easy to change, or we call it mutate. Mutation may enable the coronavirus to spread faster from person to person, and may cause more severe disease. So, because of that, we need to understand more about it, and we should understand about the way we are living with it, with that virus. And of course, that we need to know how to treatment if we got infected with this kind of virus. For till now, just main prevention is just physical distancing, hand hygiene, and especially is our vaccination strategy. And please look at this graph, geography that Vietnam vaccination updating. So I really want you to count the number of vaccination more than the number of infection, because it's very important that the good news is over 100 million doses all over the country. And as you see that although the new infections still increase, but the daily death is decreased. So the newest variant is Omicron has not found in Vietnam till now. Because of the pandemic, although 2 years, it impact us in two ways, negative and positive. And as we see that after 2 or 3 years, or we really don't know that how long the COVID will exist, how long the COVID will be exist in our life. So we need to care more about the healthcare and about our relationship and about our college and friends. So today is very important that we need to prepare about the attitude, about knowledge, and the prediction that we can handle in this years or the next years. So as we have looked at the new normal in other countries, in other countries they prepare that when they come back to a new normal after COVID-19, that they have to live with the virus. So they prepare lots of things like protect us against the criminals, or about the protect our finance, about the children's safety. And today we're going to deep into health care, that how can we be healthier and be have well-being when we come back to new normal life. But of course that there are so many challenges during COVID-19 that we need to adapt, right? That we have ton of information such as virus variants or different kind of vaccines, and how it's effective, or how the impact of the vaccine to our health for long term, or the drug and treatment therapies for treating COVID-19, that it work or still that can help us to face with the COVID-19. And of course that I know that many of you are very angry or maybe depressed about different policy between regions and places when we have to travel from this place to other place in Vietnam, right? I know that maybe most of you are living in Hanoi and Hưng Yên, but sometimes you may have to fly from Ho Chi Minh to Hanoi or to Hưng Yên or to different places. So how to know about the policy very different, right? And of course that we're changing in working culture. Some of you may working at home, some of you may come back to the office to work, and about the healthcare service, how to assess the healthcare system during the pandemic in Vietnam, right? So we need to understand about the healthcare infrastructure of Vietnam, that in this pandemic, it's very important to contact with the commune. It is the commune health centers, and in Hanoi, they are organized so many mobilized health medical center to take care the positive patient with COVID. And the upper level is district with district hospital or district center or private hospital. And we need to have this network to contact with your like office or your company to have better network to help you if you like unluckily to got infected with COVID-19, right? And we should know about Vietnam fallings of quarantine symptoms against COVID-19. And during that is very different between other region and between the region and places in Vietnam in district. Because example, I am living in Ho Chi Minh City, so most of the positive patients can be home quarantine or home isolation, or the close contact to those can have the choice to home quarantine. But maybe in Hanoi, for positive COVID-19, although they have a mild symptom or have no symptom, still have to be in the centralized quarantine, but not in hospital. And of course, for close contact of cases, have the same. So when we know about this, we will like preparing that when we move to another region, well, to different district, we will understand that maybe if I get a close contact with a positive patient with COVID, I can be isolation in one of these kind of place. And we will understand more about how to set back to a normal life. That we know that we cannot never come back to a normal life like before, right? But it is a new normal life that we can adapt to so many things like that. So first of all, I would like to tell you more detail about COVID disease. That if you got some of this sign, maybe you got the positive with the COVID-19. Have you ever got the cold or flu before? So the sign of coronavirus is very similar to that. Example, maybe you got a headache, a fatigue, or fever, or cough, or sore throat at the very early stage when you got the COVID virus. It's very common. But sometimes some of you may have no symptoms. And some of you have a very severe symptom at the very, very beginning of the stage, such as shortness of breath or pain at the chest. So if you have one of those signs, one of those symptoms, it's very important that you have to do a test to catching COVID-19. That we have two kind of testing here. The first is COVID quick test, and the second is PCR. And we should know that from the very early beginning of the disease, that is very easy to catch COVID-19 with quick test, COVID quick test. But for some of you may not have much symptoms, maybe you need to use PCR for that. And we also always preparing for the script that maybe I can got infectious with the COVID-19. So I recommend that you need to have your own ready list, such as the hospital or clinic or your company or your office should have a network with the hospital or with the medical centers to help your staffs and your employee to have the support right after you got the positive with this disease. And of course that you also need to have friends and co-worker and police and some apps to take care of your health. And the second thing is very important, that you should find your risk. If you are in, I will classify here in 3 codes. When you have these signs, which one are you? Firstly is red code, that's some very severe symptom. That if you realize that you got in red code, is immediately you should move on to the hospital or to emergency department. But if you are in orange code or green code, it means that you are in a higher risk. People have this condition. Maybe you are in orange code, although you got very mild or have no symptoms. And of course, the last one is green code. It means that you are young, you are positive thinking, you have well knowledge about the disease, and of course that you have fully vaccinated. That you can easy to stay home or get the treatment and easy to recover after 1 week from the time you exposed to the virus. And this is the day-by-day breakdown coronavirus symptoms. So we need to know about it. Then we will take care ourselves. It's better. First of all, that we have such start of illness with some of the signs symptoms, and maybe from the first day to the 5th day, the symptom is very it mild and have no symptom. But from the 4th to the 7th day, maybe it become more severe. But luckily, that for those variants, that we have 80% of people that will have mild symptom and very easy to recovery after 1 week. But if we are in the higher risk, maybe we are easy to get moderate to severe, or we need to go to emergency department from the last stage of the disease. And there are some impact to health, very dangerous. It is the COVID-19 can affect our blood, like it can create a blood clot in our body, and or get the infection of our lung. So we know about that, to aware that maybe we can be dangerous if we got the disease. But nowadays we have some treatment that could work for us. Example, when the first time that you realize that you can got the disease, you can use the antiviral. Maybe from the 1st day to the 5th day of the disease, because the antiviral drugs can prevent virus from multiplying. Because during 5 days of the COVID-19, the virus will multiple very fast in our body, so it would help. And from the next stage, maybe our body will have some anti-inflammatory, and we will have some kind of a drug here, like anti-inflammatory drug or anticoagulate drug to prevent this kind of severe symptoms and other kind of treatment. But the key that I would like to emphasize is today is the key that we need to prepare when we come back to a new normal life, is we need to strengthen our immune system to protect yourself. And we should aware that we can affect others if we got the disease. So first of all is the first factor that we have 3 factors that can have us to have a better immune. At first is physical barrier prevention. You all know about that, right? To prevent, don't touch your eyes, nose, and mouth, because it is like the door to got the disease. got the virus. So the second factor is vaccine. If you are full dose of vaccine, and it is the second barrier that helps to prevent us to get the illness or death if we got the infections with the virus. And the most important factor, the most important component that help us to be more confident when we come back to new normal is if we have a healthy body. That if you have a pre-exist illness such as a chronic disease, you should well managing your chronic disease and especially your weight, because some lots of data show that if you have obesity or overweight, it will affect our health a lot. So please remember that we have three main factors that can help us to be more confident when we come back to a new normal life, right? And we should have a new healthcare behavior. In the past, we just have something like a passive healthcare, that when we have problem, we call the doctor. But now, I think that we should change to active healthcare activities, such as that we should manage our pre-exist condition, or we should do some thing to have a healthy body, such as sport or lifestyle or food, and we combine three main factors that we will have a better health when we come back to a normal life. And this is the formula that I really want you to remember again. That please first actively monitor your symptoms before, during, and after you get your vaccine, and after during the time you come back to your working. And the second thing is balancing your lifestyle. Drink plenty of water and balance nutrition and workout, have positive thinking. And the last is control weight in your pre-existing condition of any kind. And this is something that we can prepare in our house to prepare for any scripts that we can get when we come back, right? First of all, do you have medicine at home? That there are some recommend medicine that you should prepare in your house. Firstly, is a pain medication, like for headache, fever, or something like paracetamol, ibuprofen. And if you have any allergies, you should have your own advice from your doctor. And the second is, I think some of the over-the-counter can help, such as antihistamine tablets or something like this to prevent that you for a dry cough. And third is related from indigestion. Maybe some of you have a problem with digestion, so you can prepare it, OTC vaccine. And the fourth is vitamins, or hydration supplements is very important, because when you got the disease, maybe you can have a weakened immune system, and multivitamin can strengthen it. And because of your lack some nutrition or unbalanced nutrition at your house, so you need to prepare it to supply your body. And the fifth is very important, is medicine for your chronic disease. Some of you may not know that you have high blood pressure, or you have diabetes, or you have some other severe health problem. You should prepare it. Maybe 3 months to store in your house whenever you need it. The sixth is salt water, mouthwash, and some first aid kit. And the last is prescribed medicine for severe symptoms for COVID-19 at home. I just recommend it when you are in in the pandemic is like a reason that you be isolation maybe. So you should prepare it if you are in the, maybe you realize that you maybe in the orange code. If you got the COVID-19, you should prepare it. When you cannot access the healthcare provider, you can use it for immediate for emergency situation, or when your doctor prescribe. So it's very important that when you have a network with the healthcare provider. And there are some thing that you can prepare in your house, like the thermometer or the oxygen measure, or some like pressure monitor, and the thing to check your blood sugar level is easy, and I think that is not very expensive, that you can prepare for you and for your own company. And the last thing is the how to prevent COVID and have well-being in new normal life. That is better that when we active to preparing it, right? So when we start back to work, this is some of the conditions that when we come back that we have more confidence. The first is as you heard about the COVID green card or about the COVID certification or passport, that when you got 2 dose, like full dose of vaccinated, after at least 2 weeks, your immune system will have the best, like you will like strongest at that time. So when you come back, it's better if you got the vaccinated. And or some of you may infected with COVID-19, you can come back and very confident, because like after you have fully recovered after infected with COVID-19, you have a very strong antibody in your body to prevent the COVID-19 infection again. And the last thing is negative test by COVID quick test or PCR when you return to work, or especially that you're not close exposed with a positive COVID patient after 14 days. And the active limited COVID green card, it means that when you just got 1 dose vaccinated with COVID vaccine, because some of you may have got allergic with the COVID vaccine. So, or some of you may not reject to vaccinated with COVID-19. And you should realize that who is the most at risk of developing severe or even little illness, because when we come back to work, that we will expose and we contact with so many people. So maybe we should prepare that. Will I be have higher risk when I can get the disease when I come back to work, right? The data show that the people over 65 years old, or you got pregnancy, or people with pre-existing illness, and the virus will hit men harder than women. We have some data so that just a little bit have the difference. So when we realize that we will like have awareness, and we will might be careful when we come back to work. And there's 4 key mitigation measures. Firstly, of course, that in your company or your office can have access control, such as screening for employee, visitor, and vendor, the temperature, and some sign of symptoms. That and the second is physical distancing, and we're changing our way to greeting other, right? Protect our hand and protect our mouth, nose, and eyes by social distancing around like 2 meters between other, and and the third is personal protective equipment, that we got some mask on, put some mask on, and some glasses, and something like a barrier in front of our face, And the fourth is workplace cleaning and hygiene. It's very important to clean our hand because very easy to like touch. It's a habit and very hard to change it. And the last is we should keep the workplace safe, such as we should have a practice good hygiene, like don't shake hand, just use the elbow to say greet to other, or washing hand, and especially be careful with meeting because lots of people in a closed space, it can we can increase the viral load in the air, so easy to got the virus in the closed space. And of course that when we eat, we handle food very carefully, like we should limit the sharing the food, like ensuring the place that people have the whenever you have some symptoms, you should stay at an isolation room, or you should go home if you got any these symptoms. And very important, when you have the habit that you clean the following area and object at least twice a day, especially your phone and cell phone. You touch it so many times, and the desk that your workplace that before you enter your own workplace, you should clean it, and then after you leave, you should clean it. And also in the vehicle, it is very important when you enter and then you roll down the glass to have the air is flow, and we reduce the virus workload in the air. And some of these things that is very tiny thing, but we can prevent very good relief, reduce the virus workload in this kind of thing. And this is some guidance for COVID positive at workplace. Of course, that is flexible depending on local policy. Firstly, the first step, if you screen one case is positive with COVID-19, you should have your own supporting network for medical, such as you should have contact with medical isolation, or have a place of residence to have your own isolation room, or you have contact with the mobilized medical center. And it's better when you realize one case positive with COVID is you have your very good network with supporters. And the second step is find positive patient risk. In Vietnam, we call it F0. You should stay home or in a centralized isolation place. And in Hanoi, for no symptoms or for mild symptoms, if you got positive with COVID test, you have to move to the mobilized medical center to take care of your health at least 14 days. And it's very important that if you find your risk, when you realize that if you are in red code, please call emergency. But if you are in orange code and green code, you can consider that you can stay home, or you will move into a centralized isolation place. And the third step, you should report this case information or data to mobile medical station. But in Hanoi, the mobile medical station they will agree to treat the no symptom and mild symptom, but except pregnancy and people with pre-existing illness, with two group of people have to moving to hospital for treatment in Hanoi. And for step 4, we can handle the local outbreak in Ho Chi Minh City. We should reduce the risk of transmission within the community by stop working to clean and test for exposed who close contact with COVID patient. That we should do a COVID quick test or PCR test. And if you over 80% of vaccinated staff, we can keep working and have self-tests of day 3, day 7, and more until we scan that there is no one got the virus. But for under 80% of vaccinated staff, for someone for who got fully 2 doses, they can keep working self-test day 3, day 7, and more. But for those for who's just got 1 dose or not vaccinated, they should come back home to isolate or quarantine for about at least 14 days. And I give you some of the document and material that you can search more in here. And I recommend that when you travel to another region and district, you should understand about this policy, this guideline, that if you unluckily you got the exposed or contact with the COVID patient, what they will do for you and to take care of your health. And there are some warning signs of COVID-19. Again, if you got any symptoms here, you should seek an emergency medical care immediately. If trouble breathing, persistent pain or pressure in chest, or you have new confusion or inability to wake or stay awake, it is some of the sign that is warning sign. You should call emergency. And there is some preparing for your hospital stay if you are if you are positive with test or you got close contact with a person who got positive, and you can screen or take the picture of that slide to prepare. Very important. And of course that I review some of the very, very important when you come back to work. That is hand washing is very important, because as you know that we can contact, we can touch the everywhere around us, and then we can got the virus and put it on your face. So wash your hand whenever you can. And of course the face mask, although you got the fully dose of vaccinated, it cannot prevent you from infection with the virus. It just prevent you from the severe or the later illness. So prepare, know how to wear a face mask correctly. Of course, that cleaning whenever we're around you, and preventing a closed space. Of course, when you come back to work, that you need to have in one room or one building with so many people. So the important thing is you have good ventilation. And this is the describer for what is the good ventilation. It means that you should open the window, you use ceiling fan, and blowing fan blowing air to outside, and portable air cleaner, and reduce the number of the people in one room. And we have the space, social space here. And whenever you are in a car or in a closed space, please open or roll down the glass to have better air flowing to reduce the virus workload in the air. This is the the formula. And of course, till now, although you got a virus or not, you can do the breathing exercise for prevent it. That you can have a better oxygen, like improve your lung oxygenation by this kind of lying or by this some of the exercise. And a very important thing, but some of you may very worry too much about COVID, and some of you may don't care anything about COVID. So we should balance everything, that we have the attitude at the right situation. So I think that it's very important when we choose a limited time each day when you check a COVID update, because some of you may read many negative post articles, and you sleep loss, something like that, and you cannot enjoy your life and your work. And the most important thing that I can recommend to you is please care about nutrition, because as you know that not 100% of people got the vaccine and have a high antibody in our body. Why? Because when the vaccine into our body, they need something like material to create, to build, to create the antibody in our body. So the food is the answer. If we got the good nutrition, we will have a better health, because they are the factor that they show that what make us healthy. As you see that the heart is over 50% of this thing affecting our health. Firstly is the food, and secondly is our exercise lifestyle, and the second thing is sleeping good. It means that 50% affected by healthy behaviors. So if we have good nutrition, we have good habit at eating, it will increase our health and our quality of life. And the fact that we know that we are what we eat. And some of us maybe have overweight or obesity, or we got some disease because we don't have knowledge about eating. So let the food be our treatment, right? But the challenge is we are unbalancing proportion of food. Some of us may really like fast food, or because of the busy schedule, or we skip meal, or we have to work at night, we eat lots of things at night, and we use noodle instant for that. So please be careful, because if we eat too much and we have a bad habit like that, it can affect our health, and we don't eat what our body needs. So really what our body needs is the food that is fiber, that it means that vegetable and fruit and vitamin from this thing is can help us strengthen our immune system. And the last is eat enough water. And some of us may really like coffee or tea, but the water is important to help us. You know that 60 to 70% of our body is water, so we should drink enough water. It's about over 2 to 3 liters per day, and it depends on our weight. And please avoiding reduce some of this thing like that, sugar and alcohol, because it can affect our immune system. And the benefit of exercise, maybe some of you may not have the habit of doing exercise, but the science say that if we spend at least 30% a day and at least 5 days per week, it can help us to relieve stress and anxiety, and we have improved functional mobility and increase our energy level, and we will have better sleep, and especially will increase our strengthen our immune system. And the last, it is some material that you can search more in here. And the last thing that I want to say that although the COVID is have more variants or not, we still have the right and we have the choose. We can choose the lifestyle of us, and we can like protect other by our behavior. Thanks a lot for listening. And if you have any question.
Thank you very much, Dr. Lee. Yeah, very useful information. Hello, BU viewer. If you have any questions, please feel free to ask. We will have about 15 minutes, I guess, for questions and answers before we end the sessions, right? Okay. At least I know that you will have many questions as always concerning about COVID. Please raise your hand.
I think that because you are in Hanoi and Hưng Yên, right? So I I am taking caring for some positive patient online in Hanoi. But if you have any question, you can ask me here.
Dr. Lee, I see that the number of cases in Hanoi is now increasing rapidly. So maybe we may have another social distancing in the futures.
Yeah.
So do you know what would be the change or the government movement or decisions in the new normal life? Are they very easily to impose another decision on social distancing, or at this stage we have to live with COVID-19?
Yeah, as you see that I am living in Ho Chi Minh City. As you know that we have very difficult time, like 2 and 3 months that we face with so many challenge when lots of people, so many people got infected with COVID, but we come back to new normal life. As I said before that the new infections still increase, but the death count is decrease. So it's important thing that we should have good vaccination strategy, and we have good knowledge about how to prevent. So when we have we can protect ourselves by applying some tips such as social distancing by ourselves, now we use face masks and use to cleanse our hands and something like this. But for me in Hanoi, I think that sometimes we they should they will do something like lockdown, like local lockdown. It not mean that they close all the city.
It's part of it.
Yeah.
Like in our campus, for example, if we experience any case of COVID in BUV campus, but in a class, so we should only lock down the class only, not the whole school.
Yeah.
Not the whole campus.
Yeah, as I said in the speech that we have some guidance for when we have one case positive in our class or in our communities. At first, we should close this class, just local lockdown, and stop. And then we will check who is close contact with this case, and then we will have the test to find out that who exposed and who have high risk to positive during 14 days. And then we will clean our class and clean the area around this around the campus. Yeah, and then you see that some of the like if over 80% of the students or the staff is have fully vaccinated, they can keep on studying and working. But if under 80%, they should isolation about 14 days. 14 days. Yeah. But it depends on your city policy, because Hanoi is different with Ho Chi Minh City.
Yeah, thank you.
Yeah.
If there's any questions from others, please.
I think that we like you have so many information that you got on.
Yeah, we have a questions.
Okay.
We have a question from the chat box.
Mm-hmm. Yeah. Okay, you can. Are there any cases of Omicron in Vietnam? Still now, there is no zero case of Omicron in Vietnam, but we still raise the aware that if any one fly from the other countries move in our city, they will check, do the PCR to classify that it is Omicron or any other variants.
What I have another question. What is your idea about recent cases that having vaccinations on children, and then the consequence is they just suffering from very heavy side effects, and also some lead to death?
Yeah.
Okay. Yeah.
Yes.
And I just heard yesterday that about Pfizer. They extend the deadlines of the vaccine for further 3 months.
Yes.
So so there's a lot of concerns around, and people raise the question that whether the death of the children is caused from the outdate of the vaccine or not.
Yeah. We are concerned about some new drugs for children, but because they did and they have been keep on do research when we take the vaccine. So during the time that we are worried because we have some death case, children got the vaccinated and have accident, right? And for me, because when the children got the COVID-19, it's easy to spreading compared to adults, because adults have better practical do hygiene practical, but for the children, they are very active. So they easy to got the disease and then transmit it to the other group of high risk. So for me that the ministry is also announced that it's not because the outdate of the vaccine is the reason. It's not the reason why. But the reason is about the reaction of the body when they get the vaccine, something like allergic. So for like that the data is I mean that very few, that cái tỷ lệ đó, the rate is very low, but I think that for people any death is countable. Any death is like we cannot say that that one death is possible, but that compared to other vaccine, it's the same data that the like severe symptom may have when we got the other kind of vaccine.
Okay, yes, thank you very much. I have no more questions, and I guess that the other do. So thank you very much for your time and for your sharing.
Yeah, I hope that it will help.
Yeah, and we see you in another days for the local staff.
Yeah. Okay. Thank you, and wish all of you happy health.
Yes. Thank you.
Okay. Have a great month before the next years, and goodbye.
Same to you. Bye bye.
Yeah. Thank you so much.